Good afternoon, everyone. Want to welcome you to today's webinar. Let's talk about mental health in the workplace. My name is Chris Jameson. Later, you'll hear from Ligaya and Mary, also part of NAMI Greater Los Angeles County. Just before we get started, I just want to remind you of a few things and set some ground rules. So I will go through this quick presentation here. Just to confirm, this is a safe and respectful and confidential place. So you will be asked to be on mute to begin the presentation. But when you do respond in the chat, which you will have the ability to do, please keep the comments respectful and be mindful of um, other people's emotional boundaries. This webinar will be recorded and will be made available in a few days after this webinar. Also, you can feel free to turn your camera on or off. We would like to see your face. It's really great to see people engaged and taking in the material and having reactions. But if you're more comfortable with it off, that's perfectly fine. Again, we ask you to stay on mute, just in case there's background noise or the AC goes on, and not to interrupt the material that Gaia will be sharing. And then also we'll have a Q&A session at the end. So along the way, feel free to drop your questions in the chat, and we'll read them out to Ligaya. So just keep that in mind as we go through the presentation. I just want to take a few quick moments here to introduce you to us being NAMI Greater Los Angeles County, or NAMI GLAC, as we like to call ourselves. We're based here in LA County, and we're about supporting individuals and families affected by mental health challenges, whether that's through advocacy, education, and connection. We believe mental illness is treatable, recovery is possible, and everyone deserves a fulfilling life. As the Greater LA affiliate, we're here to offer free programs, whether that's support groups, classes, or webinars across our various chapters. You're more than welcome to visit our website, namiglac.org. Again, that's namiglac.org for more information. Just to remind you, or share a little bit more about our chapters. We cover approximately 70% of the LA County area, from the San Fernando Valley, Glendale, San Gabriel Valley, South Bay, including that region of the city, Pomona Valley, and also Long Beach and Whittier. And so if you want some information to find out information, feel free to check out the steps right here at the below of the slide. And a couple more things. One, we have a warm line at NAMI Greater Los Angeles County. This is a warm line where people can call to receive emotional support or access or information on local resources. We recently began services in Spanish. So if you are or someone prefers to speak in Spanish, you can call our warm line anytime from 10 a.m. to 8 p.m. Monday through Friday. And we're also available over email at hope@namiglac.org. Okay, and finally, with all that out of the way, I want to welcome you and introduce our facilitator today, Ligaya Lange, who is the Director of Corporate Outreach for NAMI Greater Los Angeles County. She leads the Stigma-Free Workplace Initiative and previously implemented and managed NAMI GLAC's Connect with Hope warm line. While she's not a mental health expert, she spent 15 years in corporate entertainment, working for Fox and Disney Studios and Deloitte Consulting. Her lived experience with generalized anxiety disorder, primarily her struggle with postpartum anxiety and OCD when she had her daughter, inspired her to start her podcast, Let's Get Mental, in 2022 and 2023. Her bravery motivated her to change the focus of her career to mental health, where she champions maternal mental health awareness, corporate wellness for NAMI, and access to mental health for all. And so with that being said, I want to turn it over to our leader today, Ligaya.
Hi, everybody. Thank you so much for joining this Let's Talk About Mental Health in the Workplace. I am Ligaya. I'm the Director of Corporate Outreach for NAMI GLAC, and I'm so happy to have you all here today. I will warn you that the presentation is very rich in content. We have a lot of verbose slides, but I will do my best to paraphrase and get through them. It's a lot of information. So if you have questions, like Chris said, I just request that you put them into the chat. Hold off till the end. We'll have a full Q&A. And, just try to bear with me as I go through all of this information. And we will send the presentation out afterward. It will also be recorded. So don't worry if you don't get all of it. You can definitely look it over after the fact. So with that, let me just share my screen with you. Before we begin, kind of as Chris said, just want to emphasize that this is a safe space to share and feel comfortable amongst your colleagues, NAMI staff, and the presenter. So you don't have to be on camera. Anything that you would like to ask can go into the chat. Don't be shy. We always like feedback and questions, so please feel safe to say anything or ask anything that you would like. So today, what we're going to go over is number one, we're going to go a little more in depth on NAMI and NAMI GLAC, just to make sure everybody's aware of what we do, who we are, who we serve. Then we're going to go into current stats and trends on mental health in the workplace. Third, managers and colleagues, when and how to have mental health conversations at work. Building resilience at work. Considerations for remote workers, mental health stigma. We're going to define what that is and how it affects people in the workplace. And then finally, we'll do a brief overview of our stigma-free workplace initiative, which, as Chris said, I run for NAMI GLAC. So just thought it would be appropriate to let everyone know what we're doing to reach out to companies in the community and partner with you. Okay, so let's get into it. So who we are, NAMI, the National Alliance on Mental Illness, is the largest grassroots mental health organization founded in 1979. We have over 600 affiliates across the United States, 50 state organizations. We educate and support. We have our classes and our support groups. We have advocacy at the federal and state levels and local, and obviously support and public awareness. And then who we serve, individuals living with a mental health condition, anyone that's affected by a mental health condition, family members and caregivers, community partners, and targeted populations. And what we offer is our education programs, support groups, presentations, now corporate wellness, and outreach. Specifically, NAMI Greater Los Angeles County, the chapter that's hosting this webinar. We have 6 local chapters, including NAMI South Bay, Long Beach and Whittier, San Gabriel Valley, San Fernando Valley, Pomona Valley, and Glendale. So just want to make everyone aware that wherever you are in the Greater Los Angeles area, we do cover 70% of that. And so there's always a NAMI chapter that is close to you. And we offer all of our resources online and in person. There's a mix of, it's hybrid. So if you just go to our website, namiglac.org, there's a calendar of events for all of our support groups and classes and all the information you could possibly need. You can always email info@namiglac.org. And as Chris said in the beginning, we have our very important Connect with Hope warm line that's reachable Monday through Friday, 10 a.m. through 8 p.m. Pacific Standard Time. So that's just a brief overview. In the background there is Trouty in the middle, which is Trouty Winters, our executive director. So that's just a quick overview of the Greater Los Angeles County chapter. Okay, so let's get into it. Workplace mental health, current stats and trends. So these statistics kind of drive, not kind of, they absolutely drive the entire presentation. These are very current statistics. So this is, really a look at what is going on today and how it affects workers and also companies at large. So we have the reality. So 1 in 5 US adults, so 20%, experience mental illness annually. So if I was to ask everybody in a room to raise their hand at many of the presentations that I do, very few in the beginning will say, will be forward about having a mental health condition or having struggled in the past. But once we go through the statistics and show all the different types of mental health conditions that exist, usually by the end, they will be much more forward about having a mental health condition. There's absolutely no shame in it. And that is why we should feel free to talk about it in the workplace as well as just within our personal lives. So according to ASHA, nearly 1 in 3 US workers say their job makes them stressed
Oh,
always
shit.
or
Mute.
often. Oops, we need to mute everyone, Chris, sorry. 50% of US employees reported burnout in 2024, with Gen Z being especially vulnerable, so that younger generation. We'll talk about that a little bit more later. As of this year, 36% of employees cannot access their mental health benefits. We'll talk about that a little bit more later as well. They either don't know where to access it, or they just about 1/3 of employees just don't know what their companies offer. So companies may be offering mental health benefits and your employees just may not be aware or know where to access them, which is something that's easily fixed, but you just may not be aware that that is a problem. More than half, 52% of employed Americans believe their employer is not doing enough to support their mental health. So that's an important statistic. And when we look at the bottom line, the cost to companies, according to Gallup, low morale costs American businesses up to $550 billion annually due to lost productivity from absenteeism, illness, and other factors in their work environment. So mentally distressed workers are 3.5 times more likely to miss work, costing employers approximately $340 a day for a full-time employee and $170 a day for a part-time employee. As work stress intensifies, 88% of employees say wellness support is as important as salary. So I think that's really important for anybody on this webinar that is a leader or a company manager. That statistic, 88% of employees saying that wellness is just as important to them as what they're being paid, I think is so important just to understand that mental health and well-being is really important to employees in this day and age. Companies that invest in mental health wellness programs see a return on investment of $4 for every $1 spent. That's an ROI of 400%, so that's pretty good. So the bottom line here really is that company leadership can't really afford to ignore mental health. So this is something that is really important. These statistics are kind of the backbone of this presentation. So again, we're going to send this out later, but keep them in mind as I continue. So, oops, I think we just went through that. Okay, invisible mental health. So most mental health concerns obviously are not visible. People, they struggle in silence, especially if they have thoughts of suicide or self-harm, which none of us want to think about. Those two topics are really difficult to grasp and talk about, especially for people that do not suffer with those types of mental health struggles. But a lot of people do suffer from them. In our study, stigma, fear of retaliation, and a lack of communication were cited as reasons why employees do not talk about mental health at work. And by the way, anything that's underlined in this presentation, you can right click and open the hyperlink later if you want to see any of the sources for this information. So, we just ask, have you ever wanted to ask a coworker about how they're feeling, or have you held back from sharing about yourself? I'm sure many of you have wanted to ask a coworker, but maybe since mental health there is stigma attached to it and it's a little bit of a taboo subject, maybe you don't bring it up or you don't know how. So hopefully this presentation will help with that. And just a statistic to keep in mind, more than 2/3 of employees, almost 70%, say their managers influence their mental health, a figure that surpasses the impact of doctors, 51%, and therapists. So again, for anybody that's on here who is a leader or a people manager, keep in mind how much you impact your employees. To have more of an impact than doctors and therapists is quite significant. And if I had written the whole quote, which I didn't, in many cases, you have more of an impact on your employees than their spouse or partner. So that is just something to keep in mind. So contributing factors to workplace stress. So we have our internal factors and we have our external factors. So internal, we have psychological safety. And basically what that is just promoting an environment where employees feel safe and open to talk about their emotions and or talk about their experiences without fear of retaliation or being ostracized. So that's psychological safety. I just wanted to define that really quickly. So that's an internal factor, whether or not you have that at your workplace. Obviously, company culture plays a big role in your mental health. Being in a high stress or high pressure environment, low morale, untrained managers can have a huge role. Uncertainty and change. We know in this day and age, particularly in Los Angeles, that the economy and the workplace, just in terms of entertainment and our economy in Los Angeles is changing so much, especially with the onset of AI and different things. People are really afraid of whether or not they have job security, and there's constantly org changes, and people are very worried about those things, and it causes anxiety and depression and other types of mental health conditions. External factors, political and societal unrest. I don't want to make this into a political conversation, but obviously lately in Los Angeles, we've had the fires, we've had just things that are happening at the federal level that affect us as a state and then locally and cause, just unrest amongst everyone, and everyone has to bring that to work. So whatever's happening, all the current events are external factors that can impact your mental health at work. Obviously, financial challenges, the youth mental health crisis, caregiving responsibilities, not just moms and dads, but just everyone who needs to take care of anybody in their family or anybody in their circle, in their village, as you could say. Those responsibilities weigh on everyone. And then managing your health and well-being. Everybody says have work-life balance, exercise, eat healthy, sleep. And that's much more easier said than done, as we all know. So those are some external factors. And those all come from NAMI.org. Those are 2024. That's information that you can click there and see more if you want to. And then just another statistic to keep in mind, or just a fact, the mental health landscape in Los Angeles is shaped by a complex interplay of the COVID-19 pandemic, homelessness, crime and public safety issues, climate anxiety, and economic factors. These events highlight the need for increased access to culturally competent mental health services and resources, particularly for vulnerable populations and young people. So again, that's from the Department of Health. So particularly in Los Angeles, since we're the Greater Los Angeles County chapter, I just wanted to highlight that. Okay, so how do we have these conversations in the workplace about mental health? It's definitely something that people approach with caution, and they're not sure whether they should, but you should. The bottom line is you really want to, especially if you're a manager of people, you want to identify someone's struggles and have this conversation with them sooner than later, because it can lead to that absenteeism and low performance and different issues if they don't get the help they need when they need it. And they may have it available through your company, or there are resources like NAMI or therapy or different things that they can do to help themselves. So we really want to have these conversations, especially if you are a manager. So the do's are: let the person know that you're there to listen, lead with empathy and compassion, be prepared with resources, tell the person they are not alone. And if you feel comfortable to share your lived experience, that always helps to relate to somebody. So just to paraphrase this, there are things you can say, and down at the bottom for more information on how to have these conversations, there's an actual NAMI guide for managers. So do click on that and look at that later. You can actually download a guide on how to do this. But you just want to approach somebody with care and empathy. And just say, you know, I've noticed that maybe you're having a hard time, and I just want you to know that I'm here to listen to whatever's going on, and it's confidential, and I'm just here to help. You know, just offer yourself as a resource and an ear. And then when we say be prepared with resources, that may mean knowing what your mental health benefits are with your company and saying, hey, we have an EAP program. You can get 10 free therapy sessions, or there's NAMI and the support groups, and they're all free. And, you know, or if there's a crisis, you know, we'll go into 988 in a second, but there are places to go and resources throughout Los Angeles County, the state, and the country to help people. So definitely go in as prepared as possible. Again, we have that guide for managers if you would like to look at that. And then the don'ts are don't minimize or dismiss what they say. So if they say, oh, you know, work is really stressing me out, you're not going to be like, oh, well, work's not a big deal. Or, you know, don't minimize anything that they say. Just listen and just be an ear for them, and don't suggest, you are not a doctor unless you maybe are, but don't suggest diagnoses, solutions, or treatments. You may suggest that maybe they want to go to a doctor or a therapist, but don't play doctor ever. If you're afraid of about safety for some reason, never go into the conversation alone. And this is a hard topic, again, suicide, but if you suspect or you hear that somebody may be withdrawing and having, you know, suicide prevention is a whole other presentation on its own. And we have a lot of resources through NAMI GLAC and NAMI.org that talks about that. But if you think that somebody is at risk for that, you're only doing them a favor by actually talking to them and offering yourself as a resource to hear them out and get them the help they need if they need it. So please don't be afraid to bring it up if you think that it's an issue. And if there is a crisis, you can call the 988 crisis line. It's a 24/7 statewide, I believe it's countrywide, but you can click on that later. It'll tell you exactly. But it is a 24/7 crisis line. And just so you know, 90% of those calls get de-escalated. So it doesn't mean that you're going to call them and you're going to end up in a 5150 hold in a hospital or anything like that. For the most part, they de-escalate these calls, and they try to really assess the situation and try to help. And they're trained through Dee Dee Hirsch, and they really know how to talk through any of these situations. So don't be afraid to call 988 if you need to. There's always the NAMI warm line. There's information at the end of this deck on that, but there are, like we said, you know, be prepared with resources. So again, please visit the NAMI guide for managers for more information on how to have these conversations, but it's very important that you not be afraid to approach people, especially if you're a manager, and have these conversations, or just a concerned colleague. You're only helping. Okay, lots of text on this page. Probably best to read it after, but workplace resilience. What is it? It refers to an individual's ability to adapt to changes and overcome challenges while maintaining productivity and a positive mindset. It involves coping with stress, recovering from setbacks, and maintaining a focus on organizational goals despite adversity. So it's so important to build for yourself and for your employees resilience, especially in this day and age with all of the unrest and the change, especially in Los Angeles and the job market that we're all dealing with. So for leaders, some considerations, I'm not going to read through all of these, but I'll just paraphrase. You know, you want to create a supportive culture that encourages open communication and psychological safety, which I defined earlier, and a growth and opportunity mindset for your employees. You want to encourage healthy work-life balance. Flexible schedules are very helpful. Remote work options may or may not be the best options, but we'll talk about remote work in a bit, but it's good to have that flexibility, especially for parents. And paid time off, like mental health days, are very useful. They also help, you know, eliminate that stigma around mental health. That helps employees manage stress and burnout. Provide access to resources, let them know, have, you know, a meeting on the mental health insurance benefits or the EAP or the ERG, you know, employee resource group that you may or may not have. Make sure that any mental health resources that you have are available to your employees and they know where to get them. Because as we said earlier, many, like a third of employees don't even know what they are or where to go. Um, this is interesting. Build a resilient org structure. So it's all, the way you're organized as a company is also important. Just establish clear goals and metrics and ensure everyone knows what exactly is expected of them. So sometimes just not knowing, um, what are you expected to do? How do you get promoted? How do you keep your job? How do you know, are you supposed to do, every single thing that's thrown at you, or can you prioritize? Do you prioritize? Employees don't always voice these concerns, so it's up to leaders to really make sure that they let their employees know, clear goals and roles and what is expected of them. Um, Encourage creativity and innovation, encourage employees to think outside the box and be flexible for everyone. Again, I can't stress it enough. Make sure you're aware of your company's mental health benefits. Use them. Take that mental health day if you need it. It's important to cultivate strong relationships at work so you don't feel isolated at work and work doesn't feel like a lonely place. It's good to have good, strong relationships, and that can be difficult when you work remotely, which a lot of people do. But it still can be done. And again, it's up to leadership to try to help your employees cultivate those relationships. Actively manage stress and seek help if needed. So many different coping skills. So the American Psychological Association Coping Skills Guide 2024 is here. I couldn't list all of them, but there's so many. But please, look at that list. But you want to identify your stressors and you want to come up with coping skills and ways to manage them. You don't want to just let them, go out of control, really. You want to make sure that you know what's causing you stress and that you know what to do to help yourself. Um, don't let stigma stop you from being vocal if you are struggling with your mental health. That's so important. We'll talk more about stigma in a second, but that's, you've got to be vocal if you're struggling because you need to get the help when you need it to prevent yourself from possibly not being able to do that well at your job and possibly, threatening your job. So you want to get help. You want to maintain a healthy lifestyle, easier said than done, but adequate sleep, healthy diet, regular exercise is so paramount to good mental health, and having resilience and flexibility in the workplace. You want to create boundaries to ensure you have work-life balance. It's so hard for people to put down their phone or to just say no to a manager or just maybe say that, I don't know that I can handle this project right now, but this is the way I can do it. In what I was reading, it's always good to, when you're having a conversation with your manager, don't just complain, but maybe have a plan, right? So if you can't handle everything that's thrown at you, it's okay to vocalize that, but just maybe say, this is how I would prefer to prioritize it. What do you think? So have those boundaries, don't be afraid. And always prioritize your mental health just as much as your physical health. That is so important to us here at NAMI and for you. So your mental health is just as important, if not more important than your physical health. And so if you talk about having a broken leg or a sprained ankle or whatever, why are we afraid to say that we have anxiety about work or we have anxiety about our personal lives or what's going on in the world or we have something else? We shouldn't be afraid. So I guess I did read all that. I'm sorry if I took all that time, but I think it's important. Considerations for remote workers. So today, in 2025, approximately 32.6 million Americans, which is about 22% of the US workforce, are working remotely. While this is a decline from the pandemic era highs, it's a substantial increase from pre-pandemic levels, signaling a lasting shift in work culture. So we all know what happened during the pandemic. We were all forced to work online and everybody had to adjust. And then it became something that a lot of people liked and wanted, and a lot of people prefer a hybrid, a more flexible work schedule. So even though in Los Angeles and for the tech companies and the entertainment companies, and I think, really across the country, we're seeing much more of a pull to go back to the physical workplace and the office setting. I don't think well, I shouldn't say what I think, but obviously remote work is here to stay in some form. So currently, 22% of us are remote workers. So we really have to consider that when we talk about workplace mental health. So remote workers struggle more with isolation and blurred work-life boundaries and increased anxiety. The absence of face-to-face feedback and social support can increase anxiety and contribute to feelings of depression. The absence of spontaneous social interactions makes it harder to maintain a sense of community. This is a very interesting fact to me, that the constant use of technology and notifications can lead to cognitive overload and mental fatigue. So employers play a crucial role in supporting remote workers' mental well-being by fostering open communication, promoting work-life balance, and providing resources for mental health support. So again, sorry to put it on all the leaders and the managers in the room, but it is up to you. If you have a staff that is 50% remote, 75% remote. I know in our stigma-free initiative, when we talk to corporate partners, some of them only have 2 or 3 people that are actually coming into an office. And the rest of the time, maybe 2 days a month they meet, or maybe less than that. So it's up to you as a leader and a manager to create those social or activities where people are able to come together, even if it's on a Zoom screen, and see each other's faces and interact with each other. If it's a staff meeting that everybody goes to and puts their camera on, or encouraged to share, or anything that you can do to bring everyone together, do it, because it is so important, especially if you have a lot of remote workers in your staff. So let's go back to stigma and why it's important. So, stigma defined. Mental health stigma refers to the negative attitudes, beliefs, and stereotypes that society holds about individuals who experience mental health conditions. So, this is what we're really dealing with in the workplace. And I know that I've spoken, in speaking to some of our chapter boards when I'm talking about the stigma-free initiative. I've been faced with a lot of questions, or just being told that, Ligaya, this is all wonderful to do this type of programming, but we can't defeat the stigma. We can't deny that it's there. And even when, an employer wants to do what's best for their employees, we can't change the fact that there is a stigma around mental health and people are afraid to talk about it. So it's true. It's very present, and it's something we need to work on, especially as a leader and as a resource like NAMI, Greater Los Angeles County, with all of our support groups and everything that we offer. It's about step by step, day by day, just encouraging people, promoting awareness, and encouraging people to openly communicate about their mental health and not be ashamed and not be afraid. So that's where it comes back to leadership and building that kind of environment where your employees are free to communicate about their mental health and aren't afraid of repercussions. So again, why it's important. Mental health stigma prevents people from speaking up about their mental health struggles to their managers or colleagues. Stigma prevents employees from getting the treatment they need when they need it, and this may result in lost productivity at work. Lost productivity is often a hidden but significant cost for companies, like we talked about earlier. Across the country, $550 billion lost due to this. So what's the solve? So like I said, it is step by step, day by day, encouraging and promoting. But as a leader, as someone who's a manager at a company, you can commit to eliminate workplace stigma around mental health. Foster those conversations and employee engagement on the topic of mental health. Have the conversations. I can't say it enough. Mental health conversations matter in the workplace. Employees want to have them. They want, like we saw earlier, 88% believe that their company is not doing enough to acknowledge mental health. That's huge, 88%. um, 9 out of 10 almost. So we need to do better, right? And NAMI, we're here to help you, but you as the leader, it is up to you and your managers to really foster environments where you're having those conversations. So what specifically can you do? So here's where I'm going to talk a little bit about our stigma-free initiative. It's something that we offer through NAMI GLAC. And before I get into this, this is our specific initiative. There's a NAMI National Stigma-Free Initiative, but our approach is different and at the chapter level, and I'm going to explain why. But you don't have to do something like this. It might be very helpful to you, but any sort of program that you can implement or culture or just activities for your employees to promote openness about mental health and encourage communication in an open, mentally healthy environment is good. So what the Stigma Free program is, it's a close and collaborative partnership between your company and NAMI GLAC. So I, in particular, work with the companies as the director of corporate outreach, but you will also see my executive director. Our executive director, Trouty, is very involved. Our facilitators, you'll see later, we do a case study on our pilot program, but it's a very close and collaborative partnership with us. It's a tiered program, 3 to 12 months of programming. It's donation based. Better your workplace mental health at a nominal cost to your company. So when we say donation, it's really, I'm not going to put the dollars up here, but it's really, when it comes down to it, I've in construction, for example, they pay their safety managers. I'm almost 200,000 for each one of them. In many cases for the large construction companies, and they have like 12 of them per firm to talk about or to protect the safety, the physical safety of their employees, but they don't really invest in, I'm not going to say they don't, but a lot of them do not value the mental health and the mental safety of their employees. So that's just one industry, one example, but we put a lot of emphasis on physical safety and physical health and not so much mental health. So the amount that we request as a donation that supports our cost-free community resources, it just supports NAMI GLAC in general and our support groups and our classes. It's really quite nominal. So it's not a huge amount, and it's worth it. And you can't forget about that 400% ROI that you may get. It's programming that's customized to your industry and your employees. I'll get into how we customize it in a bit. You build trust company-wide and improve overall performance, foster a healthy, productive, and supportive work environment. And at the end, you become a certified NAMI GLAC stigma-free company. And, we've had a few companies say, well, how do we show that we're stigma-free? How do we show that we completed this program and that we care about mental health? They want to show that. So at the end, whether it's a certificate or something we can put on your website or your social media or something, you can put in your office, we will make sure that you're recognized as a stigma-free partner. So this is a big question I get. What is the difference between NAMI's signature and stigma-free programming? So signature programming is the programming that we offer through NAMI that is cost-free to the community. So those are our support groups such as family, connections, and peer, our education classes such as family to family, basics on demand, peer-to-peer, presentations such as In Our Own Voice and Ending the Silence, and our outreach and our advocacy. So that's all through NAMI, cost-free. We do it all the time for anyone in the community can access that. Stigma-free corporate partnership programming is different from that. It is completely customized to you in your workplace. So it's company driven and it's also data driven. So we utilize opinion surveys to gather data for program design. So we really design the program around you and your employees and what your desires are in terms of mental health and well-being and what kind of topics you want to cover, what types of activities you want to do. It's customized by company. It's designed to address the concerns of everyone. So leadership, people managers, and your employees. We bring NAMI's evidence-based practices right to your door. So we will actually bring our support groups, our class, or some of our education classes, whatever it may be, right to your company on site or make it available just to your employees as one of the stigma-free activities in your program, we really bring it right to your door. So we have peer-driven support and focus groups. So we might bring the support groups and do focus groups right again on site with you, or we may do it hybrid if you have a lot of people who work remotely, but it's something that is really tailored to your company. And at times our presentations may be led by industry experts. We've done that in the past. If it's appropriate, if I'm not the right person to give a presentation on a topic, I will just acknowledge that and I will find somebody who is the right person. So we will bring people in if we need to make sure that the experience and the content of what we're sharing with you and your employees is valuable and relevant and impactful. So what does it look like? So this is just an example. So we had a pilot program we did with Accenture SoCal, very well-known consulting company. It's huge across the country, been in the news lately with the regular workplace, issues. But the industry, it's consulting. There were 800 for Accenture Southern California, SoCal. So that was Los Angeles and San Diego. The program duration was 3 months. It was a pilot program, and we partnered specifically with their mental health employee resource group leads. There were 2 people that I really spoke to most of the time, all the time, and they were the ones that did all of the planning with me and NAMI. And for the activities we did, there were 15 meetings and check-ins. This was the pilot program, so there was more that we had to talk about and figure out, but that's just to say that for the 5 activities we had, for each one, that's an average of 3 meetings. So again, it's so customized. It's such a close partnership between NAMI and you to make sure that it's a valuable experience for you and your employees. And when we did the survey, their biggest concerns were burnout, number 1, 2, how to help colleagues struggling with mental health, which I was pleasantly surprised with. And number 3, work-life balance, which obviously consulting firms, yes, they struggle with that. I used to work at Deloitte, I know. So on the right here is the program and what it looked like. So February, we did a kickoff. We did the employee survey. It was hybrid. March 20th, we did a webinar on managing burnout, NAMI's stigma-free approach. For that, I brought in a specialist, an industry expert, Bobby Green, who used to be the head of DEI for USAID, which you may be familiar with, is one of the first organizations that was impacted with the current administration's cancellation of some of the DEI programs. So she has now started her own consulting firm, but she was the former head of DEI for USAID. She did a fantastic job. And she did the webinar on managing burnout because I wanted to make sure, as their number 1 concern, that we did the best presentation possible. And then we did a presentation that I did that was on site on how to discuss mental health and improve work-life balance. So some of the content you saw today, and then I added work-life balance since that's their third, highest concern. So I spoke about both of those things, recorded it, we made it available to people after. And then what we did in May was we brought in one of our family support groups on site physically to Accenture. And the idea behind that is what I said earlier, bringing our tried and true practices, our evidence-based, our evidence-based resources that we have at NAMI right to your door. So we have our support groups, and we thought it would be most appropriate when we discussed it to bring a family support group to Accenture. And we did that. And we had one of our NAMI support group facilitators come and do that in person. And then interestingly, the virtual support group that was done online, I will say was much better attended. And I think it was one of those things where people physically could see people going into the room for a support group and were a little bit timid about doing that because then everyone could see that. And plus it was a very open workplace with glass walls and windows, everybody could see inside. So these are all these considerations that you have to think about when you're having these types of programs for mental health is, the fragility of the topic and people's, comfort and how open they are to doing all of this. So, but it's about eliminating the stigma and bringing that support group to them and then having them take part in it and it not being such a foreign thing anymore. And the virtual one was much better attended. I would say 4 times as many people came, and some of them, everybody spoke and participated except for one person, and a few of them ended up using some of their local NAMI chapter support groups. They were no longer, they understood what it was and they were no longer afraid to use those resources. So that's what this program is all about, is also familiarizing people with NAMI and other resources and making them comfortable using them. So that is a brief overview, maybe it wasn't that brief, sorry, of our stigma-free initiative. So with that, I think we're almost at time. We have about 10 minutes left, which is perfect. I just want to say thank you to everyone for joining, and here's our information to stay connected. I'm going to send this out again for anybody that wants to use it, but also keep in mind our social media. But if anybody has, and our warm line, of course. But if anyone has questions now, let's do our Q&A. So Chris, I can't see the chat. Does anybody have any questions that they'd like to ask?
Yeah, before I guess we get to people raising their hand, there were a couple questions in the chat.
Okay.
Jeremy asked what industries were the reports and research for? I believe he was referring to maybe the first or second slides with the statistics.
Oh, okay. The first or second slides. Let me see. Um, Let me just look because there were a lot of slides. I guess we're
So,
probably.
hey, just to clarify, so you're talking about managers and the mental well-being of managers, and I'm in the HOA industry, which is a particularly unique one, and I also work remote, so which is also particularly unique on my portfolio, and we deal with a lot of mental stuff because of we're dealing with clients directly that are homeowners that are not bound by anything. It's not like a customer this and that. They have rights and they have a lot of expectations, and a lot of times those expectations are superimposed onto us. So I was just curious, as because this is a lot of great information. I would love to know how to bring this information back to, because I always say that you need to have an on staff therapist, especially for HOAs. So when some homeowner calls you with something about their dead father and their this and that and their leaky toilet, which has led to their husband cheating on them, like, whoa, I
Yeah.
don't need all that. What do you do to establish these initiatives in your organization? Um, how have you found it? Right? How can you get involved? How can you bring something like this to an HO industry like CAI and have people generally accept it?
I think I spoke at one of your lunches recently at the Skirball. So maybe you were there, maybe not, but they did like a mental health stress luncheon for managers in HOA situations. So I absolutely know what you're talking about. So your question is, how do you implement these types of programs? Well, again, we have our program through Stigma Free and NAMI, but it's the most important thing, I think, is to establish that type of environment where you're having the conversations with your people managers, with the people that are dealing with these clients that come to them with all of these stresses and they kind of put them and project them onto you. You have to teach your employees how to maintain boundaries and how to manage high stress environments and situations. So, as a manager, again, unfortunately, it does kind of fall on you, but I will just say we have many, many resources available through NAMI National, so NAMI.org, their stigma free program. A lot of the information there is just guides and things that you can download and research. And by knowing what the key stressors are for your employees, identifying them, like doing a survey might be a great idea. I know you're like, I really don't want to have to create a Google survey right now, but it's not hard. And
Not hard.
finding
Chat
out,
GPT.
yeah, yeah, there you go. Use the AI, find out what their real stressors are. What are their issues? Because you can't, one of the things I've found, and that's why we customize the stigma free program so much for each company and each industry, because everybody's needs are different. And I hear you on HOA, and I heard everybody who spoke to me after I presented I was there for a long time. People telling me like all the stresses and what they come out, and people come and just lay it all out on them. And I can't imagine, honestly. One of them, I think I do that to my, anyway. Um, so I get it, but you have to identify what the main stressors are, figure out, study, research what the best coping skills are, and find a way to bring your employees together and share that information. That's all you need to do in a program. Share information, let them know where to go to get information. You can't have a therapist on staff all the time, but you can know what local resources there are to receive therapy. For example, USC, through their graduate program, offers 10 free therapy sessions with a graduate student. So you're not getting like the PhD doctor of doctors, but you're getting therapy from, and it's free. So there are so many resources that you can bring to your employees. I'm happy to speak to you afterwards or at another time, but it's really about knowing the resources, knowing the stressors, knowing the correct coping skills, and sharing that with your employees, however you want to do it. So that's really what goes into building a program, or just building and cultivating an environment that is helpful for their mental health. Did that help at all?
That helps immensely. I was actually just typing in the chat if you could add those resources, because I would love to do something like that, because I think this is very important. When we just not, I mean, because let's face it, our president is going to quickly dismantle DEI as much as he can for the bottom line. And honestly, DEI is one of those things that, if you understand our history, is very important to giving people the resources that they need. They have been denied for so long. And that doesn't just go for disenfranchised folks. I think that goes for everyone who's struggling, right? And I think DEI recognizes that everyone is struggling, and offers them a solution.
Yeah, I will just say that in trying to partner through Stigma Free, we're trying to differentiate what we're doing from DEI, and we're just calling it healthcare. That's
Healthcare, got
about
it.
mental health being
Yeah,
prioritized just as much as physical health.
I love
So
it.
we'll say, oh, well, we can't really do DEI right now. We're like, well, we're not doing DEI right now.
Sure.
It is very important. That's a totally other political topic I can't really get into, but when we're talking about mental health programs and well-being in the workplace, that is healthcare.
Yeah,
Bottom line, you know?
clear.
So that's another way for you to approach it where you can depoliticize it a little bit. But
I
I'm
really
happy to
appreciate
talk to
that.
you after, and I will share the resources. So please, Chris or Mary, my wonderful volunteer, please note that those resources need to be shared. Okay.
Awesome.
Thank you, Jeremy.
You're welcome.
Next question.
Yes, this question is from Andrew Cantor. He asks, do you have any special advice for fighting stigma among people in occupations which require quote unquote fitness and thus inherently discourage openness about mental health issues? He goes
So
on to say uh, that he's a lawyer and he knows the stigma is serious with lawyers. And he also says like it could be even more harmful for first line responders.
Absolutely. That's a jam-packed question, by the way, Andrew. I'm really glad you were able to join. Feel free to unmute yourself if you want to talk to me. That Cantor and Cantor is one of our newest stigma-free partners, and I'm so excited to work with you. So knowing that, this is one of your concerns, it's definitely yes. So when you're a lawyer, or for example, we're working with a sports and entertainment company at the moment as well, or we're trying to, there is this facade, or this the way people perceive you, is that what you're referring to, that maybe you need to be tough, you have to have this mental toughness, and that you can't, it really makes the stigma that much more potent, really, because you really feel that you can't come forward. And I think the way to really counteract that is to just hit it head on, in terms of, programming, like which we're going to be doing with you and your employees. We'll just talk about it, research what is that perception that lawyers feel like they need to maintain. What is that, how are they supposed to purport themselves, and how does that stop them from being open about their mental health? Even privately, people struggle. They think, well, I'm a lawyer, I'm a public speaker, I'm a director of corporate outreach, I work for mental health, I can't have mental health problems or anything. Like, or I'm an athlete, I'm a fitness instructor, anything like that. And first responders, absolutely. Cops, firemen. I mean, this type of issue is one of the biggest issues when it comes to stigma that we deal with. And one thing that really hit me was in working with the construction industry. Those guys out in the field really have this expectation to be tough and to not talk about their mental health. And their management and their leaders for some of these firms have just made it a priority to hit that head on. And they share their own lived experience with their employees to get them to open up about their lived experience and or their own experiences. And it's really been inspirational seeing how those groups, some of those employees, like 60 of them sitting in a room, then become so open by seeing their leaders kind of take down that wall and say, I may be a foreman, I may be, the CEO of this company, I may be blah, 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 but I have X, Y, and Z issues that I worry about. And I think we need to talk about it because we need to prioritize mental health as much as physical health. That's really the idea that we need to get across, is that mental strength and physical strength are just as important, and it's really, I think, in my opinion, about hitting it head on and just having those conversations and talking about specifically what is the perception for you and your employees, and how can we deal with that perception and still allow these people and these employees to like come out of their shell and speak openly about their mental health. So I don't know if that helps, but we can definitely talk more about it during your partnership. So I don't know if you want to unmute. Did that help at all?
No, it helped a lot. No, I
Okay.
definitely appreciate it. Thank you.
Okay. Thank you. Okay, next question.
Yes. And yeah, do you want to say we are a little bit over, so if you need to
Yes,
sign off,
I'm sorry. Yeah.
we
If anyone
appreciate your
needs to jump
time.
off, please do. And if you have questions that I cannot address during this time, put them in the chat and feel free to jump off and we will take them and I will personally respond to you if you put your email in there. And we will also follow up over email if you have questions. You can respond back to me.
Okay.
We will hit all of them, I promise. But are there any
Oh.
others? Yeah, go ahead.
Yeah, forgive me. Yeah, there's one final question. Marlene says she loves her remote job and lives in Riverside County, but they've recently been asked to make a 5-hour round trip commute to Hollywood for in-person meetings. The anxiety caused by these meetings is making them seriously consider resigning. What do you recommend that they do in this situation?
Yeah. So unfortunately, this is happening. As we talked about, across the county, the state, the country, people are being asked to return to physical office locations, and it is causing a lot of stress and anxiety because it changes your whole work-life balance. And I don't know how many people work in your company or how many people are being influenced by this change. But what is always helpful is to come together as a community and as a group, as a cohort, and maybe communicate your concerns as a group so you're not alone, and approach your management. Again, this open communication is something that takes courage and strength on behalf of the employees, to go to their managers and say, this is not a sustainable situation for me. It will affect my mental health and therefore may affect my job performance. What do you suggest I do? And sort of that's what I've read. And in my experience, again, have a plan, like maybe suggest a compromise, but don't be afraid to say it. That's insane. I'm sorry, I shouldn't use that language. That's, wild, 5 hours, a 5-hour commute. That's so much. And that would wear on anyone. And I know from my experience commuting from Orange County to LA for years, taking the train, doing a van pool, anything I could do to cut down me being behind the wheel for 2 hours on the 405 each way. I understand. I can totally relate to how you're feeling. And I did communicate with my managers, and a lot of my coworkers were going through the same thing. So what ultimately ended up changing was having people come together and then approach management and say, hey, this is not sustainable for us. This may affect us. This may affect our job performance. It's definitely not good for work-life balance. They don't want to be hit with, they don't want problems at the end of the day. Trust me. Leadership at big companies, especially, they have their HR departments. They don't want to be in trouble. So if you voice your concerns and you're articulate and you're thorough and you are assertive with your concerns, whether you put it in an email or you ask for a meeting and you bring your community together, your coworkers together, and address it as a group, that always helps. But don't be afraid to address it yourself if you need to. It's just not sustainable. And that's what you have to say. And you have to articulate how that's going to affect their bottom line. If employees then have, issues with absenteeism and not being able to complete their jobs, or not being, healthy and not being able to be productive, that's going to affect the bottom line that they care about at the leadership level. So if you want to ask me that, I can also speak with you privately after, or email with you and, give you some tips based on whatever your situation is. I'm happy to do that. So just reach out. I hope that helped.
Okay, that was our final question. So, I guess with that being said, yeah, Ligaya, do you have any final words?
We are going to follow up with you following this webinar in the next day or two. I will send out the recording. We'll make it available, I believe, on our YouTube, right, Chris? Or maybe also on our corporate wellness website. Please feel free to reach out to me at my personal email here, or the stigma-free email, if you're interested in our stigma-free initiative, or if you have just questions in general. I'm happy to correspond with you, or to do a quick Zoom meeting. That's what we're here for. So, and we are also going to send out a really brief, maybe 3-question survey, just to make sure that we hit points and that this was useful for you. So please fill that out when you get it. Other than that, thank you so much for joining today. I wish you all good mental health, and that you have a good rest of your week. And again, please feel free to reach out to us or myself if you have any questions. So thank you.